right, y'all. Good evening. Good evening. We are checking in for a special Olympics edition of the Real Physician Reacts. Yours truly, Dr. Pierre. Thank you for checking in. Remember, hit the share button, hit them hearts. We appreciate you. For those who will be catching this on the replay, especially if you're on YouTube or one of my podcast listeners, remember we always do this Thursday evenings. Well, let's say Thursdays. It just happens to come Thursday evening, but we typically do this Thursdays on the live tip. So if you want to be able to have some questions answered live, we are here. So today we are going to be talking about, I think is an accomplishment. A lot of people, right? A lot of people had a lot of questions about this gentleman behind me. Again, if you're listening to this on a podcast, you may be wondering, what am I pointing at? I have a picture of our gold medalist in the 100 meter for USA and bronze medalist in the 200 meter, Noah Lyles. And why are we talking about Noah Lyles today? Because we found out today, unfortunately, after his race, that he was diagnosed with COVID a couple of days ago. And my timeline is pretty split because obviously as a physician, I follow a lot of healthcare folks and just non-healthcare folks, right? So there are folks who are like, wow, that's wild. I can't believe he would run while having COVID. And other people were like, man, I can't believe he was able to get a bronze while having COVID. And then there was a lot of questions. We're going to answer them. Because there was a lot of questions about, hey, Corey, how you doing? There was a lot of questions about, hey, what do you mean he had COVID? And like, why is he able to kind of walk around like no one's business with COVID? So we're going to answer the questions. So first and foremost, make sure you hit the hearts. Make sure you hit that share button. Much appreciated. Again, recap, we are be talking about our guy right here, Noah Lyles, bronze medalist, gold medalist, and the fact that he was able to get a bronze medal while having COVID. And first and foremost, I saw a lot of people try to say that this was some type of cop-out, like we were giving him an excuse because he was favored to win the 200. And when he got bronze, people were like, wait, what happened? Because especially if you watched them, or if you watched him before, you know he didn't look like how he typically looks. So there was already questions even before we heard he had COVID because he just didn't look the same, right? Oh, we get Mr. Betts is asking, what is it between a cold and COVID? A lot. I'll definitely get to that. That's a very good question, right? I think it's a good question. Remember, there's always a good question. So there are a lot of people who are looking at Noah like, nah, he don't look the same. Something's wrong with him. It just looked weird, especially after he ran. You know, he's typically running around the track like most of them are doing. He went down to the ground almost immediately. He went to go find a chair. There were Olympic people kind of around him that you could tell that were kind of the medical staff around him. So there was some concern like, man, what's going on? This looks weird. Like, why are they having to attend to him so shortly after the race? And of course, for those who may not know, he does have a history of asthma, amongst other things, but asthma definitely, especially when we're talking about this conversation here. So you have this elite athlete, history of asthma, ends up getting COVID a couple of days prior and still runs the race. So first and foremost, let's talk about the Olympics and COVID. Because, of course, people were kind of freaking out saying, like, hold on, how could he even race if he has COVID? Like, obviously, right now he's wearing a mask. Like, how could he even do that? Well, the Olympics have essentially said, hey, you know what? We're treating COVID like we would treat the flu, right? And I know that's going to ruffle some feathers, but I want us to kind of let's move with me now, because I know that's going to ruffle some feathers. They are treating COVID like they treat the flu. And essentially they're saying, hey, you know what? We are going to leave it up to the athlete and their trainers to kind of decide what they want to do with it. And when I say what they want to do with it, we're going to leave it up to them to wear a mask if they want. We're going to leave it up to them to isolate if they want. We're going to leave it up to them to decide whether they can continue with whatever event. Because obviously he wasn't the only one who had COVID, and I fully expect a whole bunch of them probably got COVID over there. it just is what it is. So the Olympics already said, hey, you know what? Our the way we're looking at COVID is, hey, if you got COVID, it's just like you got the flu. And I'm not going to kick you out because you got the flu. I'm not going to bar you from racing or swimming or whatever your event is because you have the flu. So I'm also not going to do that for COVID. I'm going to put the onus back on you. And I'm seeing y'all questions, and we're definitely going to get to y'all questions. So, and just to kind of recap, no mandatory protocols, treating COVID like the flu, self-managed health measures. I'm just reading this from the Olympics as far as what they will need to do. For athletes who are competing while positive, athletes who test positive are still allowed to compete if they feel up to it. And isolation and mask use, there are no mandatory isolation protocols or masking, right? But they do encourage, right? So they go on the aspect of encouraging, hey, if you got COVID, we encourage you to wear a mask. We encourage you to isolate and, get away from folks. We encourage it, but we're not going to force it. And of course, for those who, if you're here and definitely remember how bad it was when COVID first came around, you may not even be able to process something like this, right? Now, again, I'm in the United States. I'm in Florida, which unfortunately is one of the states who acted like COVID was a nothing, even when COVID was still a problem. So you can kind of imagine how maybe the rest of the world may operate a little bit differently, may not be as fearful of or concerned about a COVID diagnosis, whereas another country may be like petrified of a COVID diagnosis. Just so we can kind of understand, because this is kind of what's happening, right? You're running into a situation where you have this federation that's dealing with all of these different countries, and of course you can't mandate. It's not like you're mandating, oh, you got to wear a mask, you got to vaccinate. You're not mandating any of these things anyways. So they essentially say, hey, you know what? We are going to leave it up to our athlete here to kind of decide what they want to do. And of course, he's decided, hey, I'm still going to run. Because again, if you follow Noah, you know that he talks pretty confidently. I love it. Anyone who knows me knows I'm Team Noah. So I am 100% behind anyone who is confident in their skill, especially if they put the work behind it. But he probably understands, hey, you know what? If I go out there and tell them I can't run because I got COVID, they are going to look at me crazy. They are, and by they, I mean people who don't like him, which apparently I found out during this Olympics, a lot of y'all, I don't say y'all, a lot of people don't like him, especially stemming from his comments on the NBA. Like there's a lot of NBA fans who really don't like this guy right here because of it. Whatever. I mean, we won't even go there. So you have an instance where you have an athlete, superior athlete. Mind you, again, he just won the 100 by like 0.005. Like he just won the 100 meter and he's running in the 200 meter. He was already favored. But when you see this race, if you see the race and you see him running, it just, and again, and I'm not copying any pleas for him. Right. Shout out to, I forget the gentleman who won. Right. But shout out to the gentleman who won. I'm not copying any pleas for him. But you could just tell this was not peak Noah. And you may be asking, all right, what does COVID do, or what can COVID do to cause these problems, especially if you're like a runner, right? So one of the things, and we talk about COVID a lot, but one of the biggest issues with COVID is that it's an inflammatory disease. It causes a lot of inflammation, especially in the lungs. Now, it does it in different other places of the body, kidneys, lungs, but like especially in the lungs. And with that inflammation, you have a decreased ability to get oxygen where oxygen is needed. Who would need oxygen in a short period of time at the most max capability? You best believe a sprinter. So here you have a runner who already has a history of asthma, develops COVID, gets COVID. At least he was diagnosed a couple of days ago. We're not sure how symptomatic he was because, like I said, all of this is kind of coming out today. And then he has to run the race and like 20, it's 20, like, and it's wild because he had to run like 200 meters in 20 seconds. But it was slow because like that's Olympic folks, right? So it was very interesting to kind of see my timeline And that's why I was like, oh yeah, we're definitely gonna talk about it today, because I could see some of my timeline being like, I cannot believe he would put others at risk. Like, I can't believe he would put all of the other runners and staff and everyone at risk. And people were like, and other folks were like, well, you know what? If they're treating it like the flu, I'm gonna treat it like the flu. Which is it's a long time coming, right? We've had, especially if you've been following me long enough, we've had a lot of discussions where I said, hey, we are gonna need to get to the point where we talk about COVID. And we were, again, I was praying that we got to this point where we would talk about COVID like we would talk about the flu. Am I saying COVID is like the flu? No way whatsoever. It's bad. But with the interventions that we have, the treatment that we have, vaccinations, like the things that we have to try to protect ourselves from it. I was praying for the day that we could get to this point where more and more of these types of discussions could be had. Now, of course, I think because COVID is still fresh, mind you, this is like 3 years. COVID is still fresh in 2 years, fresh in a lot of people's mind. So I 100% understand how someone can get almost like PTSD, like hearing that someone had COVID and they were running around in public everywhere. But again, I live in Florida, and I can tell you, there's a lot of people who walk around with COVID and they're free. They're free. And I work in a hospital. I go to the hospitals. A lot of people, staff, non-staff, walk around, no mask. When I go to like that phase of fear of COVID-19, especially in this country here, has zoomed past us. Like that's not here anymore. Whitney. Oh, and so Whitney asked. So what happened is he actually found out 2 days ago. So he knew for 2 days. Someone asked, did he find out after the fact whether he had COVID? No, he knew 2 days ago that he had it. And from what they report, he was isolated. He was keeping to himself. But when it came time to race, like, hey, I got to come out and race. Like this kind of after, like he was wearing a mask like in the back before he was about to come out. Which, again, I thought was weird. I was like, oh, why are you wearing a mask? I thought, like, oh, that's okay, interesting. I didn't think none of it. And then when you see him run the way he ran, I'm like, oh, okay, that's why he's wearing a mask. And then, oh, yeah, he's got COVID. And again, a lot of people were upset because they thought we were making excuses for him. Again, I'm not making an excuse for him. Again, congratulations to the person, I don't know his name, who got first place. I'm just saying that I think it was a very interesting time that we can see kind of on full display, just for the whole world to see, like how people are looking at COVID in year 2024 versus how they looked at it in year 2022, right? Like I think it's very, very interesting to see. Let me get to some questions. I saw questions. I want to make sure I do not ignore them. I'm not sure if y'all still on, but I apologize if y'all not. Mr. Betts had to ask, what's the difference between a cold and COVID? So, both, I'll start with kind of similarities, right? Both are viruses. Both can cause respiratory distress. Typically, now they're obviously COVID, SARS is what causes COVID. The rhinovirus is what causes what people may know as kind of the common cold. But this is when you start getting a major detour, like, all right, COVID is going this way, COVID is here. The common cold is typically a virus that is here year round. There isn't necessary time periods where there's like peaks to get the common cold. So it's just kind of this just up and down period. It's just always kind of there. But obviously the severity is nowhere near where COVID is. It doesn't cause nowhere near the destruction, especially from an inflammatory response that COVID does. And it's not as contagious as COVID is. It's not responsible for as many deaths as COVID is, right? So I think similarity wise, yes, there are viruses. Yes, they can cause some upper respiratory issues. But after that, like it becomes very easy to kind of separate like what's a cold and what's COVID. Now, what's been happening now is that I think, especially I see it on the timeline a lot, a lot of people who may be, especially because we're in a kind of a peak season per se of COVID, because this is typically when COVID kind of rises. So we're in a peak season of COVID. Summer and winter are the seasons for COVID, where again the cold's all year round. And a lot of people are like, man, I'm coming down with something. I ain't feeling good. My shortness of breath, and they're trying to say all of the other things outside of, oh, I might have COVID. And I don't want people to forget, right? Again, Noah Lyles should be a perfect example. I don't want people to forget that COVID is still here. I don't know his vaccination status. I don't know none of that. None of that's right now is even important, because guess who also don't care about that? The Olympics. The Olympics don't care about the vaccination status. The Olympics don't care about isolation and masking. The Olympics, like, again, this is, I want to mask. This isn't the Olympics is making me mask. All right, I want to make sure we're clear on that. The Olympics have a very lax protocol on COVID-19. If you got COVID-19, it's just like if you got the flu, and how you want to go about it is on you, per se. I'm not going to dictate like how you run around with COVID. So you can have an active COVID, and I know there's like athletes dorms over there, and I could be around all of the athletes. If you want to tell people you got it, that's on you. If you want to mask, that's on you. If you want to isolate, that's on you. This is the Olympic. That's not my stance. I want to make sure we get that clear, because I don't want no one to hop on the live late and say, oh my God, Dr. Pierre is telling people to just walk around crazy with COVID. No, I'm not telling you that. I'm telling you what the Olympics are saying, and why Noah can be diagnosed 2 days ago with COVID. Now, mind you, if he was diagnosed 2 days ago, he was probably symptomatic before. We've talked about this. COVID symptoms from a symptomatology standpoint usually are like, let's say, 5 to 7 days out. So if I start developing symptoms today that end up being COVID, I probably picked it up about within that past week, just to kind of give you an idea. And for those, again, we'll just do a quick little refresher for those, because y'all may not remember, right? Because I know a lot of people not talking about COVID like we used to talk about COVID. I got a whole bunch of videos if you actually want, but again, not important. For those during that week period that you pick up COVID, but you're not necessarily symptomatic yet, guess what? You're contagious, aka you can actually spread the COVID. You can't do that with the cold, which was one of the issues with COVID, that I can pick up COVID on Monday and be a person who can spread COVID to my family, to my friends, to my patients, and not know or not be symptomatic from it till like Thursday, Friday, right? Like which was always the issue, because then that cycle continues. I give it to someone on like a Wednesday, they're not symptomatic until like Sunday, but guess what? They done spent Thursday through Saturday giving it to more people. So that's why COVID spread so much more rapidly than just a regular cold. From that standpoint. And then just so from a visual standpoint, so because you may want to know from a visual perspective, like how it spreads, right? Like, let's say I'm in this room. Right now I'm in a room. You can't see I'm in a green screen, but I'm in my room right now. If I'm talking, right, just me talking, and I got COVID, and I got the COVID just kind of going into the air, because, it comes out from an airborne perspective, it can lay around the room, right, for quite some time. And then it can go a distance, right? Like I can talk, and it can kind of travel a little ways, let's say to 10 feet, 20 feet, whatever, right? The number doesn't matter. Versus the cold, when I have the cold, you almost have to be like right here. You almost have to be like right up on me to get the cold from me. Versus COVID, like we just in the same room. Like we're in the same dorms. Right, we're in the same, Olympic, village, whatever. Like that's all it would take for the COVID to kind of spread. It's just so we can kind of just visually think about like why COVID spreads, much more frequently than everything else, right? But definitely a very good question, good refresher, right? Because again, a lot of the discussion, unfortunately, has been kind of going away from COVID. I actually have a YouTube video out. My most recent podcast and YouTube video out right now is talking about the rise in COVID cases. The link is in said bio. And then we're going to ask, Emerald had this question again. I apologize if you're not on no more. Any thoughts on why they allowed him to be around, right? So again, that's really the issue. I think the Olympics does not want to be policing countries in a way. Like you don't want to police one country that doesn't really police itself like that. Like let's say the United States was like very like, oh my God, like if I get COVID, keep me away. Okay, that might a rule like isolating, social distancing, wearing a mask may be cool for the United States. But what if I'm from Haiti or Jamaica and I don't play that rule? Right, like I don't care, like whether you got COVID. Like I'm not scared of COVID. Like what if I'm one of like those countries? I can't have the same rule where I'm restrictive and they're okay with it. But if I try to do that same rule to someone other country, like they'd cause problems, right? So for them, they're like, hey, you know what? We're gonna put the responsibility on you, right? We're gonna say, hey, country, you're responsible for how you're gonna operate with your COVID. Now, again, I don't know what would have caused him to. Well, I don't know what would have caused him to even want to test himself. But again, I'm assuming, especially with a history of asthma, he probably came symptomatic pretty quickly. And he was like, okay, yeah, I got to make sure. And of course, they're like, all right, fam, like if you got any respiratory issues, I'm going to check you for the COVID, just like I wouldn't check for flu because it's not necessarily flu season. But I'm definitely checking you for COVID, right? Because we know COVID rises during the summer. So we know that, yeah, this is during the time where I would expect COVID to, cause respiratory issues. So I'm not necessarily sure what prompted them to even test him in the beginning. I'm not sure if he said that yet. But I can just think from a clinical perspective, him having a history of asthma and then, getting COVID and having to be a distance runner, he probably noticed some things. He probably noticed, hey, you know what? I'm getting way tired more easier than not. I'm huffing and puffing way much more than I normally do. Like he was probably noticing physically, I'm not myself. And because I'm not myself, I got to go get checked out. That I'm just spitballing. I'm just giving my best medical judgment. Remember, don't take me for granted. I'm just a regular physician. Let me see. Oh, Mr. Betts, another good question. If you got the COVID vaccine booster, so I got the flu, or if you got the COVID vaccine booster, so I got the flu or COVID. I'm not necessarily getting the question. If you got the vaccine and booster, so I got the flu or COVID. I'm not sure if you're asking if you got the vaccine or booster, could you get the flu or COVID? If that's the question, the answer is yes, you can definitely still get it. And remember, and this is the thing too, especially for those who follow me, y'all already know. The two things that the vaccine and booster does, the two main things that you need to know. Don't listen to no people say that, oh, if you get the vaccine booster, you'll never get COVID. That is not true. That is not the case. That was never the intent. The intent was two things: to decrease your hospitalizations, like the decreased amount of times people are ending up in a hospital from COVID, and to decrease deaths. So when you grade the vaccine on those two things, don't grade it on nothing else. Nothing else. The vaccine is wildly successful. Anyone who argues in the year 2024 about whether the vaccine and booster is ineffective or was wrong or not going to take, just don't pay them no mind, right? Like they're just not making any factual sense, and there's no numbers to back up. There's no numbers to back it up. Again, and I talked about it this week. You're going to have increased number of cases because this is the summertime. But thankfully, those who got vaccinated, those who got boosted, and even those who social distance wore a mask, thankfully, we've done a good enough job that the strains that are out there, the variants that are out there, aren't as strong, aren't as virulent, right, is the word, than others. So it's not sending us to the hospital at the same rates. It's not killing us at the same rates. So yes, the number of cases are rising because that's what they do. But the number of deaths and the number of hospitalizations have remained flat. Not to say zero, because yes, people are still dying from COVID. People are still going to the hospital from COVID. So it's not zero, but it's the height of it is flat, which is what we've been looking for from a wildly successful standpoint. Wordle Nerdle says it takes time to incubate, so he's not at fault. He didn't purposely affect people. Yeah. I want, and this is I love that point too, because again, like I said, half my timeline, shout out my professionals. We're like, oh my God, I cannot believe he would go out there knowing he had COVID. You're going to see some people on your timeline. I'm pretty sure they already made TikToks about it. You're going to see some people on the timeline tell you, I cannot believe he would go out there knowing he had COVID. Yes, he did know he had COVID. He knew he had COVID 2 days ago. So that answer, like that question is already answered. Did he knew he had COVID? 100%. Definitely knew it. He was likely symptomatic from it. Because guess what? No one randomly tests for COVID unless you're symptomatic. Especially if you had to be tested for COVID, you know that they stick a cotton swab all the way up. It feels like almost like to your brain. And no one is going to purposely get that test unless they have to. Like they feel bad, like, ugh. Like, so yes, he knew he had it. But no, his incubation stage was likely 5 to 7 days prior to him even going to get tested and feeling so bad that he needed to get tested for it. So yes, could he have passed it on to other people? Yeah, the same way someone likely passed it on to him. I don't know where he got the COVID from, but again, he's in Paris, right? It's the Olympics, a whole bunch of athletes, a whole bunch of staff. Again, and no one's wearing masks because no one is wearing masks. So yes, I'm for sure he got it from someone, right? I'm for sure if they stop the Olympics right now and say, hey, you know what? We want to test every single one of these athletes in here. I think a lot of people would be surprised how many of them pop positive. Now you could there's a lot of what we call asymptomatic people. A lot of people who hit positive for COVID, but don't get symptomatic from it. And because they don't get symptomatic from it, there's never, ever a reason to test. And because there's no reason to test, they never know that they had it. And then you have some people who get positive for COVID, and because they get symptomatic from it, they know something needs to be done. Oh, and then we go get tested. So I swear, if they did just a village-wide screening of whatever that athletes village that they be describing, I think a lot of people would be shocked how many people pop positive for COVID, which is why we don't recommend just routine testing for COVID. I'm in the state of Florida, in the United States, we're not just recommending you to get routinely screened for COVID. You have to have some symptoms that trigger us to say, you know what, let me make sure you don't got COVID. Let me make sure you do not have COVID. But it is not something that we just because especially if you're asymptomatic, right? There's no reason to routinely test for it. And because, again, when we fast forward in the year 2024, we have remedies and treatment courses that can prevent you from going to the hospital. Hey, take this Paxlovid, take this medication right here, and maybe decrease your symptoms quick enough. Now you don't have to go to the hospital. Oh, you ended up in a hospital. Okay, take this medication here. Let's steroids. Let's see if we can try to decrease your hospital stay, right? So we got enough medications, and then, like I said, we got a booster and a vaccine, right, to try to prevent it so that if you do happen to get COVID, it's never to the point where you're on your deathbed. That was always the goal for these vaccines. How can I decrease the risk of you ending up in a hospital bed on a ventilator because you got COVID? That's always been the goal. And like I said, thankfully we have a vaccine. And again, I mentioned it on my episode this week. And I think next month, I'd have to check. I think next month they're going to come out with an updated COVID vaccine, right? And I think they're trying to get away from calling it a booster, which I'm okay with, because we don't call your annual flu shot a booster. We just don't do that. We don't call it, say, hey, you're about to get your annual flu shot, your annual flu booster. We don't say that. So I think they're trying to get away from that terminology, because I think sometimes when people hear booster, they think, oh my God, the vaccine I got the first time didn't work, so now I have to get another one. No, you're just getting a new updated strain of COVID vaccine to kind of keep up with these newer strains that have been going around for the past 6 months to a year. And like I said, I do believe it comes out within the month or so, sometime in September, and I will definitely do a post on that for sure. Let's see here. Jen, I like Jen because Jen has a mask in her app. She said, why is it weird to wear a mask? There's a giant search. I don't think it's weird at all. What I think, especially for those and obviously, and I tell people I'm in a skewed population. I work in healthcare. I work in hospitals. I work in nursing homes. I work in places where COVID is. So I go towards COVID. A lot of people go away from COVID. I go, like the firemen, they go towards the fire. I go towards COVID. So, and I wear my mask all the time. I have a mask on all the time. So like you wearing a mask doesn't even register to me that you may have COVID, because I'm so used to people around me wearing masks that like I just assume you're just wearing a mask to try to protect yourself from others. I tell myself the reason why I wear a mask is because the likelihood that I'm going to run into someone with COVID is so high that I want to decrease the chance of that person giving me COVID and then me giving it to you. So my mask wearing is so that I don't give you COVID. But I can understand, especially over there, where, again, if you just look on TV, there's not a lot of people wearing masks at the Olympics. Not a lot of people at all. So it wouldn't shock me for sure that it wouldn't shock me at all that people may find it weird, because they're like, why are you wearing a mask? Because we've gotten to the point, especially year 2024, that people are just kind of comfortable not wearing masks. Again, hopefully, they're vaccinated, boosted, they're protecting themselves, they're doing the things they need to do. But it doesn't shock me. But again, I know I'm in a skewed population because I wear my mask all the time. Like I wear it to work all the time. Like there are patients who probably haven't seen my full face, especially if you're in a hospital, like in years. Like there's people who probably like this is like this, like that's all they see. They know my eyes. Like they don't know that. They can tell I have a beard because it goes under the mask. They can tell that, but there's some people who I'm pretty sure if I walked by them right there, they wouldn't remember that I was the doctor who was taking care of them in the hospital. So, it is what it is. But I can see why, someone may find it weird, especially if you're not used to it. Word on Earth says airplane travel is a big petri dish. Oh, this is another place I always wear my mask too, right? And again, remember, this is COVID season is summer and winter. What happens during summer and winter? A lot of travel happens during summer and winter, which is why we tend to see our cases kind of uptick. And again, you go to airplane, go to the airlines. You'll see how many people not wearing masks, right? You'll see that it's uncommon for everyone to be wearing a mask now, right? So to the point where you can kind of point out the people who are wearing masks, right? Like again, I'm the type, like I said, I tell myself, hey, I'm protecting you by wearing a mask. And that's how I psych myself to always wear a mask. But I can, again, some people are like, yeah, no, that mask time, that's over and done with. And they are never, unfortunately, they're never going back. Let's see, but very good questions. Ms. says there's no cure for colds, flu, pneumonia, just like COVID. So this is a good question, right? As far as this cure aspect, right? So the question, when we think about a cure, right? Like we're saying, like, all right, is there any remedy that I can take that I can never ever get this thing again? The answer, I don't want to say no, right? Because if you take the vaccine, right? Let's say you take a vaccine. And that vaccine is specifically for a certain variant, right? It's specifically for a certain variant. Guess what? You're never going to get that variant of that disease. Like that virus variant, if that matches, you're never going to get it. But what happens, right? Why do we need a flu shot? And why do we need the COVID shot? Why do we need these things? Because the more these viruses or bacteria replicate, the more variants. So yes, I may have been able to have that one vaccine today that could take care of every single variant that's like known to man right now. But by tomorrow, there's probably gonna be 10 more variants. And guess what? This vaccine right here, yes, it can cover 100 of them, but it doesn't cover the new 10. And now what happens? I get a cold, I get the flu, I get pneumonia, right? So that's why it's difficult to say there's no cure for a cold, flu, or pneumonia, right? Because I have to say, like, are we talking about a specific variant? Because yeah, if you tell me like variant A is the only cold running around, I can make a vaccine that treats variant A and you'll never get the cold. I can 100% do that. You'll never, ever get the cold. But the problem is, by the time I make a vaccine, a booster for variant A, it's already on letter Z. Like, so now I got to make a whole new set of vaccines just to cover every single letter, right? And then all of a sudden, by the time I do that, guess what? It's already working on a little a, right? So this is the that's the kind of rock and hard place, right? When people may say like, oh, there's no cure for these things, is because it replicates so fast, right? And we don't have to get into why it replicates so fast, but it replicates so fast that you couldn't possibly make one-stop treatment for it all, right? And that's just like when we talk about cold, we talk about flu, we're just viruses. Pneumonia can be caused by a virus, can be caused by bacteria. Guess what? Bacteria do the same thing, right? I had Dr. Richard White on my show like a couple months ago. Very great episode. But he just talked about like how viruses replicate, how often they replicate, how quickly they replicate. So we don't have, we just don't have the technology to be able to make a vaccine to cure every single one every single time. So this is why you get a person who ends up getting the cold, ends up getting the flu, ends up getting COVID after getting a vaccine, a booster. Because guess what? Like the vaccine booster you had covered the variants that we were, protecting you from, but we got a couple others that then slipped our defense. And now, boom, now you got, in football terms, now you have a sack. Right, you had that one defender, that blindside blitz. You didn't see him, and then boom, you're on the ground. So that's kind of but again, as in medicine, right? This is the medical high that we're chasing, right? We're trying to chase, this illustrious disease, whether it be viral, bacterial, or fungal, that is extremely smart and knows how to evade our defensive tactics. So we have to do all of the measures that we can to try to, like, if we do get the sack, we don't fumble the ball, right? Good for some of you, good little football reference, but very good question, Mr. Betts. Very good question. Oh, yes, someone asked, was I vaccinated? Oh, definitely. I am Moderna Mafia. So I got Moderna, the initial doses, and then on the booster, right? So I pride myself in being Moderna Mafia for that standpoint. Yeah, Dinah says I had the vaccine booster and had COVID. Yeah, this is what it is. And thankfully you're here to be able to type that you have the COVID for that standpoint, right? Because that's the point. We want to make it so that if you do get COVID, you're going to still be here to type and tweet and do a video about it, because we lost a lot of people, right? Again, I think a lot of times there's this survivorship bias that happens for when people kind of talk about the efficacy of the vaccine or booster. Like, I never got vaccinated, never got boosted. And yeah, you got lucky, right? That's just what it is, right? Because there's a lot of people who didn't do that and are not here with us. And there's a lot of people who did do that and they're not here with us, right? Like, it's one of those things where if the vaccine could 100% prevent you from getting COVID or the flu or whatever the disease is, guess what? They would be trillionaires, right? They would have money hands over fist if they could 100% guarantee that you will never get the disease that I got this medication for. But they can't because we live in reality. And then obviously going back to our replication and our variant discussion, that's why it'll never kind of happen. Dance this mess around. I like that. Today's incubation seems much shorter, 2 to 5 days. Yeah, I think that's always been an issue. Now again, I remember a lot of the peaks of COVID in which variant was more significant. So when we talk about the Delta variant had a longer period of incubation, aka I pick it up from someone on a Sunday. I don't get symptoms from it till like Saturday, or even maybe the next Sunday, right? Like 7 to 10 days. But the Omicron variant had a much shorter window. So now I pick it up on Sunday. By Wednesday, I'm having symptoms. By Thursday, like I'm looking for the nearest doctor's office or hospital. So it definitely depends on the type of variant spread. But we've definitely seen these shorter periods, right? And what is the issue with the shorter periods, right? Now, I don't want to say issue. Let's say pros and cons. So if you have a long period of incubation, that means if I pick it up Sunday, but I don't get symptomatic from it till Saturday, guess what happens? I have from Sunday to Saturday to spread it to everybody. I have from Sunday to Saturday to just Like, hey, you take my COVID, you take my COVID, you take my COVID, you take my COVID. Like, I have that long. But if it's only from Sunday to Wednesday, guess what? I can't infect that many people because guess what? I only have 3 days to do it. So there is some pros for having these shorter incubation periods. But now if I put my virus hat on, one of the reasons why the virus said, hey, I need to be symptomatic quicker, because the longer incubation period, especially when we started getting treatments, it gave us enough time to fight it off so that by time Saturday came around, you weren't symptomatic from it. So because it took like 7 to 10 days for you to get symptomatic from it, you know what? If you got the vaccine and the vaccine's in your system, the boosters in your system working, guess what? Like by Saturday come, you're not even going to be symptomatic on Saturday because guess what? I had enough time to kind of fight it off, right? But if my incubation period is shorter, that means that it takes a much shorter time frame to go from 0 to 100. So let's say by the time I get to 100 virus replications in my body, I get sick. Right? It used to take 7 days. Now it only takes 3 days. Right? So that virus is like, hey, you know what? I got to work a little bit quicker because they got vaccines and boosters out here that's trying to like get me out of here before like I get to 100. So that's kind of the difference as far as from an incubation period and why that was, such a problem in that regard. But yeah, you definitely tend to see some of these newer variants, like here in the United States, because I'm not sure where people are watching from. Here in the United States, the two strains that are most rampant right now are like KP2, KP3. And they're both under the umbrella of the Omicron, right? A little bit shorter time frame, a little bit of duration from a symptomatology standpoint, but definitely good question. Good question there. D says, as an asthmatic, this story with Nova hits way close home. No, it's like, again, I think him being asthmatic is probably why he felt so symptomatic from it to the point, like I said, again, I'm not copying please. I don't want people to be like, oh, you're just copying please because he lost, right? And which is hilarious, right? Like this guy is the third fastest 200-meter runner in the world, right, for the Olympics, right? Like, and people like are taking that like a loss, right? Whatever. People think we're copying please. I'm not copying please. I'm just saying if you watched him race, you would know, like, nah, this don't look like him. Like something looked off with him. And then when we get the answer, we're like, okay, that makes sense. Like once we find out he has history of asthma, and he just got diagnosed with COVID a couple days ago, yeah. Because we know already having a history of asthma already puts you at increased risk for any respiratory disease, let alone the one that causes all these big bang problems, aka COVID. So definitely for sure, I know my asthmatics, my COPDers, those of any type of respiratory issues, pulmonary fibrosis and pneumonitis, like all of those issues there, kind of felt it what he was going on with. Rewritten says, good point. Wish the Olympics had better mask wearing policy. Yeah, no, that's the thing, right? I think, like, yeah, and I'm not calling out no countries, right? But I could just see some countries being like, you can't make me wear a mask. And the reason why, right? And I said this earlier, I'm in the state of Florida. My governor is Ron DeSantis. This man was acting like COVID wasn't a thing when it was still killing people left and right. And he was acting like, nah, go ahead, wear a mask. No lockdowns, no social distancing. He was getting all of that out of, like, in fact, for those who may not remember, Florida is the reason why you stop having to wear masks on the planes because we had a judge, whatever. I'm not going to call him crooked, right? We had a judge that was in DeSantis' back pocket that ruled it unconstitutional to make the, federal agency from a travel perspective make you wear a mask, right? So I'm from Florida, the state where they're already like, you can't tell me what to do, even though they are dying left and right. Now, mind you, what I love is most of those people who were like, you can't tell me what to do. The second they got so sick from COVID, they wanted a kitchen sink in the hospital. I see them in a hospital, doc, give me everything. If you got to put me on the ventilator, do it now. Like they wanted everything, but they were talking crazy tough outside the hospital. Again, not the discussion for here, right? We're focused on Noah right now. But because I'm from the state of Florida, I can understand why if you're at the Paris Olympics, you're not about to have no beef with a United States or Russia, Jamaica, Haiti, Canada, Germany. You're not about to have no, world beef with these countries because you want to tell people to wear a mask and they're like, no, we're not, right? Because let's say I tell you wear the mask, you say, no, I'm not. What you gonna do? You gonna make me? You gonna kick me out of the swimming meet, right? You're gonna tell me that I can't play volleyball. You're gonna kick me out of the track cycling. One thing I like about the Olympics, just random, is that all of these different sports, I'm like looking at like, oh, all right, I didn't even know that was like a thing, but like, and it looks so interesting. Now, am I gonna like check it out when the Olympics is done? Probably not. But it's just very interesting to see that, like, oh, you can get a gold medal doing that. Like, okay, that's wild, right? I think I saw this 16-year-old girl. She was a gymnast. But she was doing like a freestyle gymnast thing to like one of Michael Jackson's songs, right? I'm like, first of all, the girl's 16, and she's like the best in her country doing that. And then I was like, wow, that's very interesting. And it just looked hype because she was playing a Michael Jackson song. So yeah, no, I could see why if you're Olympics, you're gonna be hands off. You're gonna be like, nah, I'm gonna put the onus on you. So if something happened to you, like if you mess around and get your whole, track mates sick from COVID, you can't blame us because we told you, hey, if you get COVID, like, first of all, we got the doctors here that can test you for it quickly. But if you get COVID, it's on you. You decide what you want to do. I'm not going to decide what you're going to do, but like, it kind of is what it is from that standpoint there. So it says likely don't have good air filtration. Like, and this is a side note. I've been hearing so many like negative things about that athletes village and people having to sleep outside and the AC not working. So I can only imagine. Right. And mind you, right. Again, I always like to preface this. I'm here in the United States where we don't got good infiltration systems in our schools for our kids. So it wouldn't shock me if you go over there and you don't got the best air filtration system. That ain't going to shock me whatsoever because I'm here in the United States, the country with so much money, and our elementary kids, middle school kids don't got great air filtration systems. So no shocker there. Tony says, appreciate the daughters wear masks. Oh yeah, no, definitely. And again, like I said, I do it and I tell myself in a selfish way, hey, I'm doing it so I don't give you COVID, right? I'm doing it so I don't give you the flu or whatever I may have. Because like I said, I do take care of a lot of sick patients. I go to multiple different facilities. And I understand at the risk of you getting something from me, especially if you're a patient who lives at the facility, because I go in a couple of nursing homes that people live there. So if you live there, you don't go nowhere, and you end up getting COVID, like who else gave it to you? Well, usually not me, but definitely one of the employees, one of the nurses, the CNAs, maybe your family, right? But like, so I understand that the risk of you getting COVID from the healthcare worker is much higher than me picking it up from you, because I'm gonna do the things I need to do to make sure that doesn't happen. But I do what I can. Like I said. It's not required. Like I said, I'm in Florida. It's not required. So I can tell you a lot of my colleagues snatched that mask off the second they had a chance. Let's see here. Everyone said I'm traveling to Dubai. Somewhere I'm now second guessing. Oh, see this. Oh, so this is a good point, right? So for those, especially if you've been following me since the pandemic, I'm not the one who's going to encourage you to be like a social recluse and stay in your house all day. Like, no, I'm going to say, hey, you know what? I understand you got to live your life, right? You got to do what you got to do. We just need to do the things that we can to prepare ourselves, right? To try to decrease the risk of getting it, whether we go abroad, whether we go down the street, whether we go to a different state. Like, we just have to do the things we need to do from there, right? So again, your hot spots are always going to be your airplanes. Any place where you're confined, right? Those big areas where you're just confined in a space. So you try to figure out like, all right, yeah, I might have to wear a mask on this, because I don't know how long the flight is to Dubai. I might have to wear a mask, on the plane, take it off when I eat, because I'm not saying, because obviously you got to eat and drink. Take it off when I eat, put it right back on, wait till I get into some, non-recirculated air, and then, get to breathe in again, right? I want you to do your travels, right? Because I know a lot of people who, they I don't want to say they went, they had some issues staying to the house to themselves, right? Because they could not do it. They were not for it, right? Shout out, hey Millie. Millie's one of my moderators. Shout out to you. She is also Moderna gang. Shout out to the Moderna gang. I know. Pfizer family is here too. Okay, Pfizer family, Moderna gang, Pfizer family. With no beef here. No beef. I love it. Let's see. 19 starting as hard as the first. Okay, this is a good question. All right, where does it typically? Now this will kind of depend on kind of the variant. Like where are you going to be likely symptomatic from a COVID-19 perspective? There's been some variants where the predominant issue was a respiratory concern, like shortness of breath, cough, tightness. That was like the predominant issue. There are some variants where they were getting a lot of GI complaints, so they were having a lot of nausea, vomiting, diarrhea, and then you test them and like, oh, hey, you got COVID, right? So, and there are some variants where like headaches was the big thing. So it really is dependent upon obviously just kind of your personal health status, how healthy you are prior to it, and then which variant is really running amok for sure. But like, yeah, you definitely get that sinus pressure and everything else. I think the Delta variant was big on like the sinusitis and pressure. Someone says the new variant booster out yet. I think it's out I think it's coming in September. I have to check because I was looking at it a couple weeks ago. Because they were saying August, September is when it would be dropping. So I'll definitely do a video update when the new booster comes out for the variants that are here. Let's see. Oh yeah, definitely. Filtration systems are so wild. How should I say? Oh, that's a good question, right? So, how concerned should I be with the rise when my kids go back to school? So I think, especially because obviously, right? You can't fix the air filtration systems in the schools. You can't do those things there. And we already know with kids, right? Even if you have a kid who love wearing the mask, right? They're not going to wear it all the time. And then again, they're going to go to a place where a majority of kids not wearing masks anymore. So it is one of those things where you just kind of have to decide where is the health status of your child. Are they at a bigger risk from getting it from someone else? Especially if, you do a good enough job at protecting them from inside the house. And if so, right, you gotta figure like, all right, let's say my kid has asthma or something like that. Obviously you talk to your physician, and then you kind of figure out like, all right, do I need to have them vaccinated? Do I need them to have the boosted? What risk are they? And that's how I would look at it. What's the risk of them picking it up from some other kid? Not necessarily from them giving it to someone else. What's the risk of them picking it up from another kid or even like, one of the teachers or the support staff there? Because again, especially again, close knit areas, filtration systems, kind of wishy washy. So it's just one of those things where obviously again, you decide amongst yourselves, kind of figure out is my kid a high risk? Is there a medium risk, low risk? And is there things I can do to try to reduce that risk? It's not going to reduce it to zero. Right. So again, we're not going to say don't go to school or anything. So, it's not going to reduce it to zero. So you just got to figure out like from a balanced perspective, like where does my kid fit in and what are some things that I can do? Should they wear a mask? Should I send them with mask if they wear it? Should I get them vaccinated or boosted? I always recommend it. But again, it's really going to be, personally dependent upon, your family and your doctor. What are the chances of getting long COVID? Oh, so this is a good question, right? Because long COVID and I think this is going to be long COVID will be a conversation that, I think is still in the kind of early phases as far as severity, as far as the numbers are concerned. Especially when COVID was at its like immense peak as far as hospitalizations and deaths. But then you were having that segment of people who kind of went through the gamut, but didn't pass away, right? They're still here with us, but they're still dealing with the effects from it. I think it's still going to be some time for us to kind of figure out like, okay, what are the most significant risk factors for you to get long COVID versus you to get long COVID? I think there's still going to have to be studies that are coming out like really honed in on focus on that because long COVID is going to be an issue, especially from a disability perspective. It is going to be it's going to be a question if it's not already a question on like life insurance and stuff like that. Like COVID and the effects of COVID, especially if you happen to survive COVID. And then when I survive, I'm not saying you had to go all the way to the point where you got hospitalized, put on a respirator. There are people who've gotten COVID, right? Never necessarily got hospitalized, but then they picked up COVID 3 months later. And then they picked up COVID a couple months later. And they're just kind of consistent harbingers of getting COVID infections. And it's just kind of slowly kind of broke them down. I follow a lot of people who kind of have long COVID groups, especially here on TikTok, and kind of talk about it, kind of talks amongst themselves as far as what some of the effects that they're experiencing, because it is different for a lot of people. A lot of people still experience the respiratory issues. There are some people who experience the cognitive issues, like almost like running through like a fog. They're not as sharp as they used to be. There's some, skin related, neuropathic related issues like numbness, tingling. So it definitely varies. And I think the studies are still going to have, and the data is still going to have to be collected on, what makes a person more susceptible or not for getting long COVID, and then what we can kind of do about it. But that is a very good question. Very good question for sure. Let's Veronica said how soon after potential. So how soon after potential exposure do people develop symptoms and are contagious? So 2 parts. So like if, let's say again, I pick it up on, and it depends on the variant, and I'll preference it with that. It does depend on the variant that you get. But depending on the variant that you get, you could become symptomatic from it in 3 to 5 days. Now, from a contagious perspective, it's typically from like day 0. Like if I pick it up on a Sunday, like starting Sunday, Monday-ish, I can start giving it to people. So that definitely changed. Like it's like a 2-part issue. Like when am I able to give it to a whole bunch of people? Pretty quickly. But when will I notice that I have COVID? That's going to be delayed. And that's always been, which again, obviously different from the cold, that's always been one of the biggest game changers with COVID, is that so many people had these latent periods where we didn't know that they had it, but they was giving it to everyone. So if you may not remember, but like there was a time where whole families were becoming afflicted with COVID, whole families being hospitalized because one kid had it, one daughter had it, one mom had it, and then, they didn't know. So everyone's in the house doing what they're doing, and boom, like everyone kind of has it for sure. But definitely a good question. Definitely a great question for sure. Good question, Veronica. All right. So looks like we're done with the questions. So again, I just had to come on here, right? We typically do our things, right? And I told people last week, I said, maybe we're going to try to see if we can do it in the afternoon, just to see if there's a difference. But because, my man Noah Lyles had this thing go down, and then I was like, that'd be a good discussion. So I said, let me just wait till tonight to do it. If you did not catch the full live, I do post the replay of it on my YouTube channel. Make sure you like and follow the TikTok page, and then link in wherever they put links at for TikTok. Go to my YouTube page, subscribe over there. By tomorrow afternoon, it should be over there. And if you're a podcast listener, you just listen to the audio, I do put it on my podcast, Lunch On with Dr. Barry. Again, link will be in said bio. It'll be on there, I think, Saturday. Yeah, Saturday. I'm trying to think. When did I put that up? Saturday. It'll be on there Saturday. So y'all be blessed. Y'all have a great weekend. All right. And let me see what is here. What is happening? Sorry about that. So y'all be blessed. Y'all have a great weekend. And like I said, I'm gonna see y'all. I'll see you when I see y'all. Bye.